Thank you so much for listening and watching and subscribing and sharing and commenting. Yote tisa kumi. This is another episode of Long Story Short. Hey, fun fact, we are about 100 days from 2025.
Oh.
Yes.
Wow.
Fun fact.
Wow.
Are you ready?
Ile mwaka wa kufosi bana bado 3 months. Can't believe it.
Mwaka ni mwaka kufosi animtake. Okay, tuliambiwa tusiimbe. lazima niimbe. And in this episode we are going to discuss the old adage. Kama kawa kama dawa, you are always one illness away from being broke. And how can you navigate that given our healthcare? But first things first. Today I am joined with my friend. Okay. Makosa ilifanyika, Jackie had to work today. And now my schedule was not scheduling, so we had to move. I'm joined by Casey.
So mesema kazi yako ni kujaza makosa iliyofanyika. Ni sawa, it is fine.
Nishasema build communities, oil family and friendships. And also, hakikisha your circle is not a cage, because your friend has content, ama ni container. I said what I said.
Okay, sawa.
But you're in for a treat. Let me say this. I didn't think I planned this. 3 qualities that Okeo has.
Okay.
Kind-hearted. You're very kind-hearted to everyone.
Thank you.
And especially to people who actually do not deserve your kind-heartedness. I've seen people who have treated you very meanly, dismissed you and disregarded you. And later on we'll speak about boundaries, and I'm glad this is full circle. So kind-hearted, I'm going to go with kind-hearted. I'm going to go with determined. I've said this to you 50 times. All Casey needs to do is decide. I feel like ukisha decide. Whatever mountains and obstacles are on the way, they will be moved and you will get whatever you need to do. And then finally, capacity building. Especially in this fast-moving economy and life, I feel like you are one of the few people who know how to develop and identify skills and resources and champion them in the right places and the right way. Yes. So yeah, thank you. Hi, friend.
Hi.
How are you?
This was pressure. You know how I feel about people talking about me, me talking about myself.
I know.
Actually, my hands are sweating, but Nisawa, it is okay. Thank you for those very nice words. Yeah, I believe I'm kind-hearted. I know for sure I'm very determined.
Yes.
And I usually say, like, when people these days ask me what I do for a living, I think my passion or my purpose in this life is to help people become better versions of themselves.
Hello.
And I do that through skills building.
Yes.
So hi, please, end up pale Tire Consult. I'll tell you more about that baadaye.
Ama tuambie tu sahi, what is Tire Consult?
Tire Consult is a capacity building company or a consultancy. So we partner with corporates, non-profit organizations to build the capacity of their people, like through training in different things, like soft skills. We do event planning. I'm an MC as well.
Yes. So, what's it? If you have resources resources here is human and also the rest, and you don't know what to do with them, these things that people crisis in corporates, that is where Okeo comes in. Before the crisis, like she will tell you how best to apply your resources.
Yeah,
where
for example, maybe just for example, you see most of the time we work on our technical skills. You're so good, you're taught to be an accountant, but nobody taught you how to think critically. Nobody taught you how to solve problems. Nobody taught you how to communicate effectively, and that's where we come in.
And how to live with other people.
Yes.
Even from our episode of group dynamics. Bana, there are people who just misbehave and they think it's normal because I do a very good job with logistics. Rest and do better. But today, let's get back to it. So the healthcare industry, we're going to talk about healthcare. And okay, I don't know if you remember, you can speak to us about when you were a child moving on, how your health journey has been in terms of accessing healthcare, in terms of over-the-counter drugs. I feel like almost all, if not all, African homes have a cabinet where drugs are kept.
Amoxil,
yes,
being number 1.
Antibiotics.
Yes.
Cough syrup. Tell us, how has it been?
How has been my health journey? I struggled with sickness, by the way, when I was young, and I don't think we had insurance. and not that I don't think, I'm very sure we didn't have.
Because if you did,
Like,
it would
yeah,
have been.
none of my parents was insured. My father was a businessman. My mom was as well a business person. So none of us had like benefits of, you know, being insured
Or
under
even the
your
knowledge.
parents.
Maybe
Yes.
it was just a note, because it wasn't a money thing
Yeah,
growing
it
up.
actually not really, it wasn't a thing.
Yes.
So I remember we relied a lot on over-the-counter drugs. That's why I'm saying amoxil. I knew for sure how amoxil looked like. Cough syrups, the Calpols and
Yeah,
everything. Of course,
yeah.
Calpols is for kids and
Yeah, yeah,
stuff. Yeah, I struggled with sickness. I used to get like a lot of cold related problems, a lot of homas. That's why I knew cetirizine is your go-to drug when you're sneezing and stuff.
Yeah.
And admission, I don't think I was admitted until I was in Form 2. And that was quite hard because
And that was without insurance.
that was without insurance.
Yeah.
And that meant we couldn't access private facilities. We had to like go for the, you know, for the public facilities. But they were way better then.
But Form 2 was just
than
your
now.
mom now
Sorry?
running the show.
Form 2?
In Form 2 now, it was just your mom who was running the show.
Yes.
Like
Yeah.
yes, sasa ndo sasa yeye ndo insurer, yeye ndo mother, yeye ndo pocket, yeye ndo kila kitu. Yeah.
Yeah, so I have seen the challenges of living without insurance. Yeah, and of course, one thing that I also noticed with you not having insurance, it also affects your health-seeking behavior.
Hello.
You see, like when let's say you have insurance today and you start coughing, you cough today, tomorrow you take ginger today, tomorrow. Day 3, you will go to the hospital.
Haraka
because,
upesi, you have access.
we didn't have insurance, so it affected our health-seeking behavior. It took so long before, by the time I'm going to hospital, this one is actually really,
You are
really
dying.
bad. Yes.
Now you are dying.
Yes,
Like only death cases go to the hospital
Yes.
because I mean, who knows how much they will ask us for?
Yes, and then you have to scout around to the hospital that charges, first of all, the least consultation fees.
Yes.
Because, you know, I remember my mom once said that what you're focusing on, daktari atakwambia nini when you're going to the pharmacy.
Yes.
Because up until today, you will get drugs, but you will not get them at the hospital. You have to go to an outside pharmacist. So there's no way we would go to a hospital that the consultation fee is at 2,000 or 1,000.
Yeah.
Should the cheapest, or not the cheapest, the most expensive should be 500. And if it can be free, well and better.
Yeah, if part of their services would be free. Consultation, I'm not sure how much consultation is currently. It might be at
3,000, 2,000,
3,000,
3,000, yes.
Yeah,
Yes.
the least amount. It probably is 2-3. So anyway, campus. Now you start working.
Yes.
Insurance.
Now,
But there's also a myth about insurance. But anyway, now you start working.
now I start working in insurance. Well, my first job I actually didn't have insurance. My first job that I remember this was actually a job that I used to go to.
That was at bank.
I was at the bank. I was an intern, so of course I didn't have benefits of insurance. I think my 18 months master work study period, that's the time I'd say I enjoyed the benefits of insurance.
But you are not in this country.
I was not in this country, yes. So really, me for one, I don't think I've been a beneficiary of insurance that much. Sina mengi ya kusema when it
Hapana
comes to
tambua insurance.
Hapana tambua mambo ya claims.
Yeah, but what has been your experience even just walking up to a hospital without insurance? How do they treat you?
Without first of let's just start from the fact that if you don't have insurance,
Because I know they treat people with insurance much more.
yes
better.
Sinakwambia, it affects your health seeking behavior. You'd go to the place that charges you the least,
Yeah,
right?
that's one.
And then when you go to the hospital and they know that you do not
You're
have
paying off pocket.
I'm paying out of pocket. Of course, they are going to, it's very easy for them to mint money from me, you know,
Yeah.
and I'm going to get a lot of charges that I don't need. And I will avoid a private hospital as much as I can.
Because even if they do that for people, the rest of us, some of us who have insurance, we don't really care. Because either way,
Yes.
you're not getting that money back. So we want top tier
Yes.
healthcare.
Eh.
I
Yes.
mean, charge it on the card. Why not?
Yeah, so I can say for one that being without insurance, the days I've been without insurance, has really affected my health-seeking behavior.
Yeah.
And that's where fruits and water come in.
Brand ambassador, kunywa maji.
Na ukule fruits.
Na ukule
Yeah,
matunda.
because madaktari wenyu, by the
It
way.
is not easy. I
How's your experience been though?
Unfortunately, fortunately.
Fortunately.
I know. It seems like bragging, but it's I have not had a problem. In fact, until this year, when a very close person to me was sick and getting them medication and getting them the right medical facilities was a challenge. I have never had a challenge with
Healthcare. You've
Healthcare.
generally enjoyed good healthcare.
I have always
Wow,
enjoyed
I love
healthcare.
that for
And
you.
even when my folks were broke, we leaned onto the social healthcare. Like our doctor friends, our nurses friends would go as their kids. So generally, and unless I'm wrong, I'd talk to my siblings. I forgot to ask my siblings, but me personally. And then when I got into working, I don't mince my words with healthcare. I'd rather lose a job. I'd rather not take a job, but you have to put insurance. Yeah, because you really are world illness away from being broke. I mean, you saw when COVID-19 came, there are people who they had to sell all their assets because somebody was dying. Oxygen was something that people were paying for, and it wasn't cheap.
And COVID-19 is actually too far. Like, how many medical funds, WhatsApp groups have you joined recently?
Yeah, cancer kwanza.
A lot of them,
Cancer is
cancer,
no
leukemia, and all that.
What? Anyway, I have really enjoyed healthcare, and in the sense of, and also let me say this to parents, because I had the privilege of growing up with very, I want to call them woke and aware parents. Every time I went into a hospital consultation, it's very interesting that my parents let me say what I was feeling. They were not speaking for me. It wasn't ati umtoto kichwa inamuuma. Mommy, say what, if it was my dad, yes. Mommy, say what you're feeling. And now they would just add on to it. Like for as early as I remember, I was allowed, I don't know about my siblings, I was allowed to say how I am feeling. Because a doctor can only treat you based on your symptoms. Yes. So even up to now, I remember the last time I was in a hospital that I didn't like what they did, I had left home. And if you come from my side of Kenya, when you leave home, when malaria has hit you, especially if you've grown up in that side, when malaria is about, your body, when your body is about to hit malaria. Another thing my folks really encourage us to do is to know your body, when your body is saying things. So I come back, and I know in my heart of hearts this is malaria. It is coming. I go to the hospital, get a young doctor. The doctor's like, it's okay, but now we have to test. I'm like, cool. We go test.
It's malaria.
No, it's not showing, because sometimes malaria cannot show.
Iko kwa incubation period.
Yeah, iko kwa incubation period. Oh, daktari ameinsist ati hapana, now what we will do is we'll just give you painkillers. I was like, I left, and I was, who is managing this hospital? Can I get a doctor? Preferably an older, experienced doctor. But most times people go to the hospital and they are afraid to speak up for themselves.
To question.
Yes. And Christ was polite and firm. I'm not saying when upigia tu kelele, just firmness to just say, by the way, me, I'm not okay. You guys think I'm okay, but I'm not okay. You guys are going to attend to me. When you hear about NHIF experiences, most times they keep you in a place where it's an emergency room, and they attend to people with emergencies based on your level of pain and your level of what they are seeing. But sometimes you are in so much pain, but you are taking it in stride.
But you see, let's talk about Kenyatta for 1 second.
Yes.
As someone who has benefited, by the way, from treatment at Kenyatta, there's a
In fact,
time
I've been to Kenyatta twice. When I came to see Mom, and then when I was arranged for a test in NHIF Hospital.
Let me tell you something about Kenyatta that most of us get wrong. Not most of us, some of us.
Some.
Kitambo
Kidogo.
Kenyatta National Hospital is a referral hospital.
Yes.
That's not the place to go as a walk-in patient. Yes. So if you go there as a walk-in patient today, you are feeling your headache or the malaria you're feeling, and you decide to go there.
To you.
Yes. And let's say an accident happens on Riverside, they're going to ignore you. That's not an emergency.
In fact, they have to.
Yeah, they got an accident and they have been referred to Kenyatta.
Yes.
So Kenyatta is a referral hospital. It's not the place to go for walk-ins. And maybe that's why the government was trying to, this whole thing of primary healthcare and universal healthcare to make sure that healthcare is accessible in the counties, in the districts, in the wards.
As much as possible.
As much as possible, such that please avoid that big facility if you can. That's a referral hospital. I think people come all the way from East Africa and places to get medical treatment there.
Unajua Kenya tunadharau ingi KNH, lakini hapa nje it's a well respected hospital.
Exactly,
in East and West Sub-Saharan Africa. It's really well known as top tier quality service.
So and maybe where we should start from, we should start from is just like us getting to understand our healthcare system.
Yes.
How things really work. And someone said our biggest problem as middle class is I have insurance. I can access tier 1 hospital.
Yes.
I mean, if I'm sick, I can go to Aga Khan, Mpisha. I don't care. But if it's not for you, like for the sake of other people who your relatives or your friends, it's good for us to understand our healthcare system.
Yes.
Like from the, what does level 5 hospital mean? What does
Yeah.
level 6? What does level 1
Stop
mean?
calling KNH toxic. KNH is a toxic hospital.
It is not. It's a referral hospital.
It is a referral
It
hospital.
could be having its own problems because, of course, one of the problems that we face as a country in our healthcare system is understaffed. Like, they could be understaffed. I have seen how understaffed they were when we took we once took our mom to KNH.
Yeah, I remember.
On a Saturday morning. She was really sick.
remember.
According to us, she was sick. She needed immediate medical attention.
If not, the head of KNH
The
should
only
be attending to her.
Exactly. The only problem is we didn't go there with an ambulance, but it
Those-
was
those-
very bad.
Those healthcare professionals like, man, I will sit there.
Yes,
So
but
I
by
wanna-
the way, actually, we sat there.
I will sit there.
From Saturday morning,
I
we
remember.
ended up leaving the hospital the next day.
Do you know?
On Sunday
I
morning.
remember.
Yes, and that's when, I think that was actually my wake-up call.
That is when you understood the system.
That's when I actually wanted to understand the system, as in, why do we have Umoja Hospital? Like, what's the sense? Mbona nimepita Umoja and St. Francis and
all these other hospitals along the
Metropolitan
way.
and all that, and I
Hey.
went to Kenyatta. They expect you to go there. If Metropolitan cannot sort you, Metropolitan will refer you to Kenyatta. Do not refer yourself.
Wow.
Yeah, so it's very important for us to understand our...
So talk to us about level hospitals. Level 5, level 4,
It's
level
not that
3.
I am a medic.
So
But from my
level
small
five-
understanding, like, for example, I
after
know...
nimesema uko na content.
Content nayo, niko nayo.
Respect
Eh,
yourself and redeem yourself in the podcast.
But hapo kwa levels, okay, all I know for sure is, for example, there's Machakos level 5 hospital.
Yeah.
It's
Watu wa macha oe.
it is well equipped when
Yeah.
it comes to things like special medical attention. Let's say for some tests, like let me use the simplest example. I know for sure if you need a biopsy test, the biopsy test is, let's say they have found a tumor in my hand and they want to ascertain that tumor, they want to ascertain if that tumor is cancerous. So they'll do a biopsy test.
Yes.
So I can get a biopsy test in a level 5 and not in a level 1.
Yes.
So that's the difference.
Because
Like,
even if you go to a level 1, they'll refer you to a level 5.
yes. Like it's a tumor. So for you to get better medical attention, they will probably refer you to a level 5. And I've also seen, for example, people get like these serious accidents, Kolondiani or stuff. If you've noted, they're usually taken to a level 5 hospital because a level 5 hospital has they are A and E. A and E here is accident and emergency facilities are way better than a level 1 hospital. So a level 1 is where you just like get primary health care. Mothers can go there for their antenatal and postnatal and stuff like that. But
They can
if you
give birth in level 1?
I think so.
Yeah, I'm not sure.
I'll find out.
Yeah, I'm
I'm
also
not
not
sure about that. Maybe someone can tell us in the comment section, someone who knows better.
You know.
But like level 5 for more, if the
Your
medical,
privilege is showing. Watu unajua tu wamezaa Nairobi hospital.
the more nini you need, the more medical attention you need, the higher the level. So yes,
Yeah. The
level
more complicated it is.
Yes, they are well equipped. Yes.
But okay. In 2015, there's a was it 37 years old? There's a 37-year-old who was leaving work. It was a hit and run, and then he spent 18 hours in an ambulance
Why?
and eventually died.
18 hours.
18 hours in an ambulance. Yes, that was 2015. Yes, because Alex Njue, I think, did the movie in 2017. Akina Nick Deda, I'm forgetting the rest of the players who did that. And first things first, Alex got into an accident. And then he went to Kikuyu. Was it Kikuyu? And then Kikuyu was not able to serve him. And then he went to Coptic. And then Coptic asked for 200K. 200K. I think this was if I remember correctly, he was a security guard or something. It was or a low-level job. It wasn't like those jobs where you have an insurance. So he dies. And when he died, Alex Njue did this movie. And making a movie in this country is very expensive because you see it took them about 2 years because the movie premiered in 2017. So that's why they are the way they are. So dear viewers, when you're watching these movies, please be kind. But that film bagged, I think, 4 Africa awards. I'm using my memory. Yote Tisa Kumi, actors used their voice, artists used their voice. I think David Rudisha was the one who premiered because he was leaving an ambulance. And just goes to show what that did. Because you might feel like, there's nothing I can do to change the system. What that did is that in 2018 now, because I think they were paid out either in 2019 or 2020. I think they were paid out 2.5 the family. No, the family. Yeah, because I mean that was negligence. In 2018 now there was an act that said you have a right to being treated for emergencies, like if you get an accident. Previously, that act was very ambiguous. If you don't know anything about our constitution, it's very ambiguous when it wants to be. Previously, it was very ambiguous, that they were not saying what happens to the hospital if the hospital decides to deny someone that service. But now, you have a right to any private and public hospital with respect to emergencies. Yes.
I'm learning that right now.
Especially accidents, yes. Yeah, so usiogope. I mean, the question is if... And I know, unfortunately, because this is Kenya, there are hospitals, but you can actually sue a hospital for not giving you... if they reject an ambulance, they are not allowed to. Because, they need to give first aid, they need to stabilize the patient. Like now, it's very clear what they need to do. They need to give first aid, they need to stabilize the patient, and something else I'm forgetting. Oh, they need to refer you. Because initially, it just used to say, once they've referred you, they have treated that as an emergency. And you know that means, it means if I'm not able to sustain Casey when she's sick, then I've referred them and I've done my job. So don't think that you can't do anything about it. You can actually do something about it. I think for the most part, sometimes we forget the power that you have and as an individual to do something, to change the narrative. And I believe even when they were doing that movie, they didn't even think about it. But one of the things they were pushing for was that, like, they needed us to have an emergency number. Do we even know the emergency number that you need to call if you see an accident?
Does the emergency number work if
that
it's
is
there?
Yes, but initially it wasn't there kabisa, so you can imagine. They were pushing for that, and then they were pushing for that, also that health act. And imagine, ka movie too. Well, iliactiwa lakini still.
Yeah, just picking from that conversation, Alex and like Alex's story, that which was very unfortunate. Maybe that's why we should talk about NHIF and SHIF.
And before we go into that, let me just give a shout out to a guy called, I think it was Brian Odhiambo, who stayed with that patient through it. And he wasn't like a very senior person in that emergency, whatever. But I'm just saying you can do something.
Shout out to good medics, right?
Yeah, shout out to good medics. And on that one, Sasa Melvi Libna, Lea, Moseti, Frank, Jemo, natuma salamu nikiwa wapi. Team, man, shout out to you guys. I say it all the time. Two things that I think you're called into: the health space and being a pastor. Well, pastor squeezy is something else, but anyway, being a pastor. But the question is, what would happen if you saw an emergency of your loved one? Forget strangers, Basi, of your loved one. Is there a number you should call? If you don't have insurance, what do you do?
If you don't have insurance, what do you do?
Yeah, because insurance gives you access to anywhere.
No, but at least now you've told us we have a right to access.
Yes, you should know that you do. Like you can take them, and if they reject it, you can actually sue them. Yeah.
Wow, okay. I'm just getting to learn that.
And shout out to lawyers, wherever you are, for doing that job.
You were saying... and I was about to say safe. My ancestors were about to learn.
Your ancestors are running the show. Yeah.
NHIF and SHIF. I was just like studying a bit of statistics where it started from. You see, NHIF has been like our longest serving healthcare. Okay,
and people have not yet even joined it.
But you see, this is why people have not joined it. Like for the last 57 years plus that it has existed, NHIF was there for people who are employed.
57 plus years.
Yes. So it was there for people who are employed. When you're employed, they're going to benefit from NHIF.
Vizuri.
From NHIF.
Yes.
And then those people who are not employed, people who are self-employed, were the most, like, not. I said the people who are employed were the ones who were supposed to benefit from it. They were
accessing NHIF.
Yes. And then people who are self-employed, it was voluntary for them to join.
Okay, if you want to,
like at least monthly, 500.
Yeah.
So I was trying to see what was why this change from NHIF to SHIF. So SHIF is now called Social Health Insurance Fund. So listen, before you criticize, the intention was good.
I know the intention.
The intention was.
The intention is as good as the housing levy, guys. Because if you hear the intention behind the housing levy, utafurahi. Like we said before, the government.
The government.
Tunakusalimia. Yes.
So that said that because watu wengi sana walikuwa wamekuwa locked out of NHIF, So SHIF is here to ensure people get medical attention, including, not actually including, especially low-income earners.
But
Because
just before you go further and defend the devil,
by the way, I'm actually not speaking on behalf of the government.
you're speaking on behalf of the devil himself.
No, you're going too far, sister.
No, here's the thing. NHIF did not lock down anyone was allowed to pay that premium. That what's that one? Not premium.
500, the monthly subscription.
Yes, the monthly subscription. They even used
Contribution,
They
I
even
think it's-
used CBOs, community-based organizations, to try and bring people. It's just that it's very hard for you to choose between eating and putting money away from when
Imagine
you will be
yenye
sick.
sijui, I don't know when I'm going to be sick. Why?
That is a school of thought, because mtoto ana viatu versus mimi putting money here at ile siku atakuwa mgonjwa, and you know that's how people think. Ile siku atakuwa mgonjwa ndo ataenda hospitali. Very learned. I have very learned friends who are
Jojo,
anti-insurance.
1 second.
Yes.
You know, that's the point. I think insurance is actually, it's privilege.
It
Think
is.
about
Nimekwambia
it.
my privilege is showing.
Yes.
Yeah, it is. Because I have very learned friends who, up to now, are not on insurance because they feel insurance inawaibia. I keep telling them.
Any
it's all-
kind of insurance, car insurance, health
no,
insurance,
as in
health insurance.
car insurance, you know, you have to have in this country. Nobody is forcing you to have health insurance, fortunately, as of today. And I think one of the reasons why NHIF failed was because it wasn't a law. Because at work, you're not allowed to opt out of NHIF.
Oh, yes.
Yes,
If you're
so-
employed.
Yes, if you're employed, you cannot
don't
say,
have a choice.
you cannot say ati NHIF yangu mnipe nitakuwa ninaweka kwa fund yangu medical
Kwa chama,
emergency
leta
fund.
tuke kwa chama
Eh,
yetu. Tukikuwa
niko-
wagonjwa kwa chama tunapeleka hospitali.
Niko na chama yenye ina take care of, we have doctors and nurses in that chama who we pay to care, like that's not an option. But the problem was getting the local mwananchi to enroll was they don't understand what it means. And even beyond
So can you say there was poor civic education, or what was the
beyond
problem?
that, even if I understand, the trade-off is what? Hunger over putting money away for
Imagine.
some fine day that when
I'll
I
get
get
malaria.
cancer, that I will pull up on it. That's the trade-off. And I would understand how they tried using. NHIF has really tried to recruit people in NHIF. I'll give them that. And also, I personally have not been a privilege of NHIF, but I know people, to me, who have benefited significantly with respect
Civil
to
servants.
Not necessarily.
Kawaida mwananchi benefited significantly. Normal kawaida mwananchi.
Kujuana ni kitu muhimu.
You
It's
see?
not who you know.
Once again, it's
It's
kujuana.
not-
Once again, it's kujuana.
It's how you know. It's
Because from what I know for sure,
significantly truly benefited. But
anajua mtu.
but ni juu their ducks were in a row.
You see?
Like you get, it wasn't that because they knew somebody peke yake, like they were paying into the NHIF. So it is just maybe what happened was karatasi yake ilisongeshwa mbele kwa chain. But see ati they were
That's the biggest problem I have with this country.
you know, it's not ati they were not paying into NHIF. Now see, I'm not condoning it, but I'm just saying that it significantly helped people. Very many people in my life. Hata sijui vile walipata hiyo nini. But
many people for that fact.
many.
I like that.
Yes.
Because one thing I know for
and
sure.
for every disease, I've seen it with people with heart problems. I've seen it with people with cancer. I've seen it with people with surgeries. I've seen several people
People
benefit.
who are not civil servants.
Imagine they're not civil servants.
Kawaida Kenyan. But
Yes.
you say they know people.
Some of them are civil servants, some of them are not.
But they know people. That's the
But
point
they
I want
have
us
been-
to underline.
But here's the thing, okay, they have been remitting their funds in NHIF. So they have a right to the NHIF.
They have been remitting through their employer.
Yes. Like it's not that someone from outside just came and benefited from it. No, they have been remitting funds. So they're benefiting from it. It's just that what I'm saying is, instead of following due protocol, maybe, because the protocol will take forever, maybe they skipped a few hoops.
That's the problem. That's my biggest problem
Very
with
big
our
problem.
healthcare facility.
Yes.
Or our healthcare system.
Yes, you
Why
must
do
know
I
someone.
have to know someone?
You must know someone.
I cannot just be broke and go and get medical attention. That's the problem. This thing of knowing people.
It is. And
And
okay.
Shif, you as the aggrieved employer.
Employer and employee. Even before I speak about SHIF, I think it's also very important for people to build communities with respect to having medical healthcare professionals in your life. Yeah, because fortunately, like to what I mentioned and some are forgotten. Like ini nyini na mention sahi. If I didn't mention your name previously, this is your time to shine. Just say you know Jojo. Even when I've gotten a diagnosis, I still make the call.
For them to fact check for you.
Yeah, I'm just like, yo, so now this is how I'm feeling, nini, or this is how my sister is feeling, or this is how my mom is feeling. These are the drugs that are being given. What do you think?
And also, apart from just knowing people and building communities, you see, I come from the development space.
Yes.
So I am just always thinking low income. Like, those are people I'm always thinking about first of all. But in my mind, goja for 1 second.
But ilikuwa kuniambia hii miaka yote imeisha ujui daktari.
Nani amesema sijui daktari?
Anasema
Don't lose the, don't
no,
lose,
I'm not using, I'm saying this low levels person.
Au madaktari wote
Hakuna
umetaja
hata
hapo
daktari
nawajua.
moja.
This is the thing. Anaweza kakuwa ajui daktari. Like, okay, naweza kakuwa najua daktari, but I do not have access to them.
Oh,
yeah, I could be knowing them, but I do not have access to them.
Yeah, because even clinical officers can really...
Exactly. So this is the thing. This is what this would have been a very good place for us to be as a country.
Yeah.
Oh, there's Zuri these days. There's Zuri chat.
Yes.
Yeah, Zuri Health, you know. Zuri can help you with that.
Yeah.
I love that for us, you see. Maybe I know a doctor, but I do not have access to them.
Yeah.
So this is us telling people...
Aliyomoka akaacha level yenu bana. Achukui simu. Mambo imekuwa mengi.
Exactly. Hapa najua daktari pia siku wapendi free consultation.
You know.
So this is it.
And I'm not saying you abuse your friends with terms of free consultation. I'm saying those things of headache, nini. You cannot like take your results to them and now ask them to stop doing their jobs for them to look at your case for free.
Lakini wewe rafiki yeka tu pia 30 minutes utusikie bwana. But this is my point. We are just saying it's good to get second opinion.
Very important.
If you'll get it from a doctor friend, if you'll get it from Zuri,
or if
whichever
you get
place,
it from
just
another
don't get
hospital.
it from Google. Yes, Zuri, your doctor friend, but just it's good to have perspective.
Yes.
Because also we've known so many people who've had like misdiagnoses because they just took, it was just one doctor who said.
And they treated something for years. That was not it.
Yeah, they treated my mother for pneumonia.
Do you know?
For a whole month.
I remember.
Someone who was, I think, developing diabetes. For a whole, I was going to say freaking month. For a whole month, you know, which was really, really bad.
Yeah, and you know, when we say treatment, it looks like kitu kidogo, lakini pesa ilikuwa inatoka.
Pesa ilikuwa inatoka, and the worst part ni, pesa ilikuwa inatoka, we were treating something that was not there, and the thing that was actually there was developing and getting worse.
Oh yeah, there's that part.
Yes.
Goodness, yeah.
So, but Jojo, for 1 second, we should talk about people who do not have insurance. Because this is the fact in our country.
Okay, let's talk about CHIF. CHIF is asking, if you don't know now, you know, wacha vile mmekuwa mkililia pay as of October.
2.75%.
I am serikali, daktari, unajua saa zingine.
But before we go to Jojo, before you actually go there,